Minister, appreciate your time this morning. We've just heard from two different states there. What is your reaction?
Look, we continue to work constructively with all of the states. We saw a record vaccination day. The numbers released yesterday, over 72,000 people, over 670,000 Australians. And as we've had the domestic supply, Australian-made, CSL produced here in Melbourne, where I am, we're seeing a rapid acceleration. So our role and our goal is to work constructively with everybody. We have our GPs doing a fantastic job. We're vaccinating in the aged care centres, and the states are doing their work. And so we just continue to work constructively with everybody.
Are you working constructively? What information has the federal government actually passed on to states and territories? Because the states are saying here that they don't have a detailed plan about how many doses they're supposed to be getting week by week.
All states have received a 12-week plan that was provided on March the 16th. All states have been working to it. I had a discussion with the health ministers just over a week ago, where all were very thankful and welcoming of it. So I think what you find is that people keep working and going forwards. Very clearly, 12-week plan, we've actually been delivering to it in exactly the volumes that were set out, and it was initially 4, then revised to be the 12-week plan, and all of those distributions are known. All of those distributions have been occurring in the volume sought there, unless a state in some circumstances has sought to revise down the amount that they wanted to receive.
Well, the Premier of New South Wales, Gladys Berejiklian, said that they had 2 days' notice of deliveries.
No, I think that we've got a plan which is out there. I can't speak to that particular circumstance. I think there's a confirmation in advance, but right now, 12-week plan, and frankly, the state's doing a very good job. There's not an issue from our end, and that exists. All have received it, acknowledged, received, working through it, and so we'll just continue to do what we do, which is make sure that these sovereign Australian-made vaccines are made available, going to GPs, going to states, and that will help Australians be vaccinated. We continue to thank Australians for coming forward and continue to urge them to keep coming forwards.
Minister, how many vaccines is CSL actually producing a week? It was meant to be 1 million a week from March 22nd.
So the first distribution, I think, was over 830,000 as they scale up. They're on track to achieve that target, and they'll be producing 50 million for Australians, and we're in a very fortunate position because of this. So we're in a very, very strong position because of it. Not many countries have sovereign vaccine manufacturing capability, and back in August it was, along with the decision to close the borders with China, arguably one of the 2 most critical decisions Australia has made, and many said don't do it, just rely on the international. We looked over the horizon. We thought there may be supply challenges. We thought there may be international relations issues with vaccine nationalism, and we invested in that Australian production, which has given us that certainty and security, and which has seen only yesterday a record number of doses administered, of vaccinations, and that's protecting Australians. As we've seen, by the way, in Queensland, where the aged care facility had a maintenance worker who tested positive, that facility had already been vaccinated and is due for its second round of vaccinations just today.
Minister, you missed your target. The end of March was yesterday. 4 million Australians were supposed to be vaccinated. Only 600,000 were since yesterday. You've missed your target. Are you leaving states and territories vulnerable to outbreaks like what we have seen in Queensland?
No, look, with respect, that was revised on January the 25th. January the 7th, when there was a firm contract for 3.8 million doses that allowed us to achieve a particular outcome by the end of March, when there was a global supply chain collapse for AstraZeneca, and what we've also seen is Europe withholding doses. We revised that down, and that's actually 2 months old, and we did that on the basis of the fact that what had been contracted wasn't certain, and so the difference between where we are now and which is still an extraordinary outcome. We're now at, by the end of today, we'll be close to 750,000 doses. The difference was that 3.1 million doses from overseas, which have not been provided because they had a global supply chain collapse. But that was announced on January the 25th. So with great respect, that goal was changed more than 2 months ago. And we're continuing to ramp up with record doses.
We're still significantly behind, though, in terms of international comparisons. In the UK, they're vaccinating about 700,000 people on average. Compared to Australia, the UK is vaccinating more people than we have done in the 6 weeks.
Well, we're working to supply, and that it's a very important thing here that we always said at the end of March, once we had the CSL-produced Australian-made vaccines, our supply would go up. And that's exactly what has occurred. And so we said we would start with the Pfizer vaccines for 1A for our aged care residents and our border control and our frontline health workers in late February, and we did. We said we would start with the AstraZeneca when the international supplies arrived in early March, and we did. And we said we would start what's called the Phase 1B rollout, our over 80s, our over 70s, our Indigenous Australians over 55 and those with chronic disease in late March, and that's exactly what's occurred. So,
but Minister, why is there no urgency though in this rollout, given we've got millions of people currently in lockdown in Queensland?
Well, there is an urgency, and
but you're not reaching your targets on time.
No, with great respect, if you take out the doses that didn't arrive from overseas, what we're doing is providing everything that we receive, subject to holding a contingency. The Commonwealth holds the contingency for second doses because that's absolutely a fundamental thing to do. Then they go out, and they go out through 3 channels. Commonwealth through aged care. In addition to that, the Commonwealth is overseeing the general practice program, which commenced last week and is the backbone of the Australian distribution for vaccines, as it is every year with flu or the National Immunisation Program for kids. And then finally, you have the states, and those states are distributing to healthcare workers. They have the potential, all state bar one has signed up to also offering vaccines for the general population. And so as you have the supply, then you have the distribution. It's not as if things are not being distributed. So I think it's very important to understand we've secured supply for Australia precisely because we saw the most intense international competition that any of us have ever known for medical resources. We saw this back in March and April for ventilators, for masks, for test kits, and we were able to do that and manage and protect Australia. And we also foresaw that there would be a potentially even more intense competition for vaccines. That's exactly what's played out. Those countries that are producing are keeping, and what we've been able to do is make sure Australia's producing. A record day yesterday, 670,000 to the end of midnight on Tuesday. By the end of today, we're likely to be well over the 750,000.